In our top story tonight at 5, the World Health Organization says COVID-19 is no longer a global health emergency. The virus was first declared an international crisis more than 3 years ago in January 2020. The announcement comes as the pandemic's impact has declined for more than a year. WHO leaders say vaccine availability has helped limit infection while also reducing strain on hospitals. However, thousands of people across the world are dying every day from the virus. Since the pandemic began, the CDC reports more than 104 million total COVID cases. More than 1.1 million people have died from the virus. Even so, the CDC reports only 17% of Americans have received an updated COVID-19 booster shot. Meanwhile, the CDC also reports the entire state of Illinois and all of eastern Iowa are at low risk for COVID-19 as of today. Meanwhile, the Rock Island County Health Department says COVID risk may become seasonal. The county is still holding its vaccine clinics on Tuesdays and Fridays. Right now, about 62% of people in the county have received at least one shot. The county says it has one problem. Not enough people are staying up to date with the latest booster. The interim administrator believes we are now in the endemic stage and says that means risk from the virus is not over.
We'll still have waves of infection. We think, especially in the winter months when we spend more time inside. And I just kind of think of it as how medical providers term diseases. We are no longer in the acute stage of the disease, but we remain in the chronic stage.
The public health emergency here in the U.S. ends next Thursday. When that happens, health department leaders say testing and vaccination costs will depend on insurance coverage options. Now, when that emergency ends on May 11th, here's how it will impact people receiving Medicare benefits. Medicare will keep covering vaccines at no cost to you. If a doctor orders the test, that will be free. If it will not pay for tests purchased at drugstores. After next Thursday, Medicare's expanded telehealth services will continue through the end of next year as well. Meanwhile, CDC Director Rochelle Walensky will leave the agency at the end of June. She calls this end of the public health emergency a transition for her role. President Biden selected Walensky to lead the CDC just a month after he won the 2020 presidential election. President Joe Biden released this statement saying, quote, "We have all benefited from her service and dedication to public health, and I wish her the best in her next chapter."